Today, I'm going to talk about the WHI study, the reason why the hormonal therapy became so controversial. Before WHI study came out, the hormone replacement therapies was used widely to relieve the menopausal symptoms. No one has done a better job of explaining the WHI study other than Dr. Haver, so I'm going to use her book as a reference to talk about the flaws in the study. Before the study came out, the hormone therapy was known to relieve the vasomotor symptoms, hot flashes, night sweats, as well as protective against osteoporosis and vaginal atrophy as part of the genitourinary syndrome of menopause. Multiple observational studies also suggested that women on hormone replacement therapy have a decreased risk of coronary heart disease and a lower disease of neurodegenerative diseases as well, like Alzheimer's. This study, many thought, would bring the objective evidence that the whole medical world needed to promote and to validate hormonal therapy after menopause. However, the results from the study were very sensationalized by media, and it did the opposite work. When we are analyzing Women's Health Initiative, it is important to understand the design of the study, the flaws in the study, and what made the controversy. It was one of the first studies in which aging women were getting attention, funding, as well as the focus from researchers. It was an exciting time and everybody was looking forward to this study. Purpose of the study, the trials, was designed to reveal the risks and benefits of hormone replacement therapy when taken by postmenopausal women in regards to prevention of chronic diseases such as cardiovascular disease and cancer. The participants in the study were divided into two groups. One group that had their uterus. So the group one, there were about 16,608 participants. Group 2 had about 10,739 participants, and they were without uterus, the ones who had hysterectomy. Now, of these two groups, the group 1 was given estrogen and progestogen or a placebo, whereas the group 2 was given estrogen alone with a placebo. The researchers studied the participants for 8.5 years. Now, let's discuss the outcome of the study. In July of 2002, I was still in the med school. This study came out and it generated a lot of attention. In group 1, there was a slight increased risk of breast cancer. The group also had shown a reduction in incidence of colon cancer and osteoporosis-related fractures, but that did not make the highlights. As the group showed increased risk of breast cancer, the study was prematurely ended. A few years later, research came out on the second group of participants where they only had estrogen and a placebo, and that part of the study was ended early due to increased risk of stroke. These participants did have increased incidence of stroke, but did not have increased incidence of breast cancer. In fact, they showed 30% reduction in breast cancer in this group. As soon as the study came out, there were alarming headlines all over media that estrogen causes breast cancer. This message was circulated so much that women abruptly stopped taking hormonal replacement. The prescriptions were denied by the physicians and they were not refilled by the patients, and everybody abruptly stopped using hormone replacement. This is exactly the time where my mom had hysterectomy and she had surgical menopause. I think she was about 42, 43 years old. And she suffered through menopause. I remember seeing that in front of me, and I was a medical student and I still could not do anything to help her. It was very sad and difficult to see your mom suffer through the hormonal changes during that time. Due to these results, the complexity of hormonal replacement therapy came in and steered a lot of physicians and patients away from a treatment that can benefit a lot of women. When we are talking about risks, there are two types of risks: absolute risk and relative risk. The media often reports headlines based on what's referred to as relative risk rather than absolute risk, but the latter is what better represents the true risk. In order to come to a more accurate conclusion about the real risk of hormone therapy, we must consider the absolute value. In the WHI study, the chance that a woman would develop breast cancer was 4 out of 1,000 per year on placebo. When estrogen and progesterone were added, the risk increased to 5 out of 1,000 women per year. When this is calculated as relative risk, it is presented as 25% increase. Whereas when the data is instead calculated As absolute risk, the increase is only 0.08%. In case it's not obvious, there is a big difference. A 25% increase versus a 0.08% increase. It is also important to note that there was no increased risk of breast cancer during the first 5 years of treatment in any group. The studies and analysis of the WHI study after 2002 have revealed that there was inadequate reporting and there was overestimation of the risk involved. Therefore, we must redefine for patients and the physicians the perception of risk associated with hormone replacement therapy. One of the significant flaws of the WHI study was the formulation of the medications. They used combined equine estrogen for the estrogen replacement and medroxyprogesterone acetate for the progesterone component. The medroxyprogesterone acetate is a synthetic progesterone, so the risk profile of that progesterone is very high as compared to and different from bioidentical progesterone. It is possible that the type of progesterone used in the study correlated to the increased cancer risk and not the estrogen as it was reported. I would like to re-emphasize that the participants who took only estrogen showed no increased breast cancer risk. This suggests that estrogen alone may not promote cancer, but instead protect against it. Isn't that amazing that the analysis of the study is contradicting the study itself? Other thing that is important to consider in this situation is that we have a lot more formulations of estrogen and progesterone available right now, which were not available at the time the study was started. What this means for us is that not all hormone therapy formulations are same. If we are considering hormone replacement therapy, we should talk to our physician about bioidentical formulations. An important point to consider also is the route of formulation. Are we using oral estrogen or are we using transdermal estrogen? Are we using any local estrogens? All of that factors play a role.